Hi, this is Vaibhav Vaidya with the Fits on the Go blog here at ACC 16 in Chicago. We're joined today by Dr. Tim Henry from Cedars-Sinai, who's going to talk to us about the Ix-Cell DCM trial. Thanks for being here with us today.
I'm delighted to be here. It's fun to be in Chicago. It makes me feel like home back snowing in Minnesota.
And it has been snowing quite a bit here too. So could you tell us a bit more about the aims and objectives and the design of the Ix-Cell DCM trial?
Yeah, I'd be delighted. So Ix-Cell DCM was a randomized, double-blind, placebo-controlled, multi-center trial to evaluate the safety and efficacy of intramyocardial delivery of a multicellular product called Ix-Cell T. Randomizing patients to placebo versus cell therapy in patients with ischemic cardiomyopathy.
And could you tell us a little bit about the results of the trial?
Yeah. So first of all, some important things. We enrolled class 3, class 4 heart failure with ejection fractions less than 35% with an ICD in place. So these were high-risk patients. But more importantly, they had to have one of three important characteristics: a hospitalization within less than six months, a high elevated BMP, or a 6-minute walk time less than 400 meters. So our goal and the primary endpoint of the trial was to look at events. And it was a composite of death, cardiovascular hospitalizations, and then acute clinic visits for decompensated heart failure. So the trial was specifically look at high-risk patients who have high clinical events.
Great. And what did you find in terms of those outcomes for these patients?
Yeah. So the good thing is for us is the primary endpoint was positive. So we did two analyses. There was a per protocol analysis, and then there was a modified intent to treat. So there were 114 patients treated total overall, and this is the modified intent to treat. And when you look at it, there was a significant reduction in the primary endpoint in the cell-treated patients, that with a p-value of less than 0.01 for the modified intent to treat and less than 0.03 for the per protocol.
Okay. How do you think these results will be applicable clinically? Will they be applicable anytime soon, or?
So it's a really good thing. If you look at, obviously heart failure is the number one cause of morbidity and mortality in the United States and really throughout the world. And there's a large number of patients who have class 3 heart failure despite optimal medical therapy and device therapy. And you're left with the only options being heart transplantation or left ventricular assist device, both of which work well, but you have trouble with cost, availability, complications. So if we could find a therapy for class 3 patients or early class 4 patients that could either reverse or prevent progression, that would be a tremendous advantage. Regenerative medicine has been a unique and I think a exciting approach to this. So we have a whole series of preclinical data that show cell therapy actually is effective. The early generation or the initial generation of used unselected bone marrow mononuclear cells. The problem with unselected autologous bone marrow mononuclear cells is that as we get older, the number of our stem cells and the potency decline. So if I give 100 people 100 million cells, it's all a variable dose. So the next generation of cell therapy has to approach it differently. And there's a number of approaches to make it better. One is to use allogeneic cells from a young, healthy donor. One is to use cardiac-derived cells. A third approach is to use enhanced cells. So what we did was, these are bone marrow. You take out the bone marrow, and then you enhance it for 2 weeks, or you expand and enhance for 2 weeks. And then you re-inject intramyocardial delivery. So the advantage of this is it's an enhanced product. It increases in particular MSCs and M2 macrophages, which we think have multiple potential ways that it could help heart failure patients get better.
Thank you so much for taking the time to speak with us about this interesting project.
I'm delighted to be here, and we're excited about this. I hope this stimulates a whole new phase of cell therapy.
For more videos like this, please log on to youtube.com/fitsonthego.